So all my braces, except for the 2x4, are placed indirectly. We'll show you how we do 2x4 bond up using bracket gauges for accuracy, but our indirect setups are done with a 2-tray system, and we'll go through the lab component of that shortly. But basically, we take an impression, it's put up in a die stone as a horseshoe. We look at the OPG, we mark the long axis off the teeth from that onto the model. We then use the Tom Pitts bracket positioning, which is all based on the canine and the smile arc, and effectively the girls put the brackets onto these models using an indirect adhesive, which is totally water soluble. Then they make 2 vacuum trays. The first tray is the softer material, equivalent what you would use for a bleaching tray, and it's a 0.6 millimeter. We use a German brand, Ökolen. Our vacuum form machines are all made by this German company, Ökodent, but as long as it's positive pressure, that's the sort of machine you want to deal with. So this is the softer tray material, and that's the one that actually holds the brackets in place. To seat this in the mouth, we have a harder outer material. That harder outer material, we use Raintree Essex, and in this country it's distributed by Dentsply, and the material is ACE, Essex Ace, and we like to use a 0.9 millimeter or 1 millimeter thickness. So this is the same material I use to make my vacuum form retainers. This is the same material I use to make my bleaching trays. When we do an indirect setup, we use the softer against the brackets, which we've blocked out so that there's no undercut area, and the harder just for the seatability of the tray. So this is a 2-tray technique. It's very accurate, and what you're going to see now in the clinic is the preparation of the patient. It's a Nola retractor. Then we're going to etch. We're going to use Ortho Solo. Because it's a metal bracket, we're going to use green glue, and then we're going to sit this tray 6 to 6. Normally when I do an indirect bond up, we like to bond 7 to 7. In this particular boy's case, the 7 was impacted, and we had to use a night-eye uprighting technique to disimpact it. So for the purpose of the video, we're bonding 6 to 6. In normal Damon protocol, we always bond 7 to 7. We don't engage though on an 014 between the 6 and 7 because of emergencies. So the normal technique in Damon, lower bond up 7 to 7. 014 wire, which you see being placed today, stops anterior to the crowding. Normally you can get away with 1 stop between the incisors, but do not engage the 7s because the wire, being so flexible between the 6 and 7, is likely to displace. Continue on from the indirect bonding for the lower arch for James Best. I want to just go through now the materials we're using. So we're using a fine etch, 37% phosphoric acid gel, and that is going to be for 30 seconds on the tooth. We then rinse for at least 10 seconds, ideally more. We then will dry, and we then apply this, which is Ortho Solo, 8th generation bonding agent. We've talked about that with the lingual retainer. We don't light cure that, nor does that ever appear on the base of the bracket. Then what does go on the base of the bracket is the green glue, and the green glue will be utilized in this indirect bond up. The main thing to stress, when you're doing indirect, you only need a fraction of glue because you're pressing down with a lot of pressure, and that pressure, if you have too much glue, is going to cause a lot of flash and a big cleanup time. So this is the green glue technique guide. Thin layer of Ortho Solo on the tooth. Then you work in the green glue into the indirect tray onto the base of the bracket. This step we don't need because the accuracy of what we do is in the lab. Here it's showing a direct bond. We then light cure, and again we're using the Cool Tool, the Dematron LED technology. The good thing about cleanup, and you saw this yesterday, is of course if you use a endo ice or cold water, you'll find that the remaining glue, which goes white when you light cure, goes back to green. So it's easy cleanup time. So what you're going to see in the mouth now is etch Ortho Solo green glue using a 2-tray indirect technique for the lower arch. Yes. So with James, we had a impacted 4/7. We use a technique that was developed by Dr. Richard Back in New York, where a 1425 copper nitrile wire is placed under the gum and bonded to the 6. So its natural reaction then is to return back to a straight length, and as it does, it disimpacts and extrudes that tooth. It's a very useful technique, and we've used that a lot, and you'll see in the mouth now how nicely it's worked for James. If I swap to the new X-ray, so this is the new OPG, which is more current, and you can see how that tooth has actually disimpacted very nicely, such that we can now get a brace onto the tooth. Another thing I want to show in this X-ray, James initially had lower Hilger's wire, and I made the point yesterday when we were discussing different types of retainers, how we've gone away from the 8-strand multi-braided Hilger's wire to the titanium wire, because this is exactly the point we're saying. You can see how these 4 teeth still have remnants off the wire, but they've debonded in between the contact points, and that's what we saw routinely after 6 months to a year with the multi-braided Hilger's wire. So now we're using the titanium wire with much greater success. So that was his 2x4. So James started his case with no room for his teeth. He was a class 3 situation. We did upper arch development, and then we did 2x4. So this is James' earlier X-ray. You can see the 2x4 system we'd used and how nicely his eye teeth have now erupted. His original OPG showed no space for the canines. It's interesting, on that 4/7, which ended up impacting, you wouldn't pick it looking at that X-ray. That's why we always need to monitor on a regular basis with OPGs. And then we'll go now to his original pre-treatment OPG. So this is the pre-treatment OPG radiograph, and you could see there was early loss of deciduous tooth with lack of space for the eruption of the permanent canines. You could see that his 1-3 in particular had no room, and in a case like that, conventionally we would have waited in the old days until James had permanent teeth, and then we'd extract 4 premolars to make room for his canines. Now you can see how nicely this case has turned out. A bit of early development, arch development using 2x4 mechanics. So just showing, there's James's lower 2-2 Hilgers, and that's what happens. It doesn't actually debond in one unit off the tooth, but it fractures in between, and that's why we've gone now to the titanium wire. James has finished his phase 1 treatment. He's now getting his brackets placed in the lower. In the upper, you can see the canines have dropped in very nicely. For the purpose of the exercise, we're doing only a lower indirect bond up, 6-6, because the 7s were the 4/7 was impacted. Talking about the lights we use, this is the original light that was developed with the green glue technology. So the benefit of using this light versus a conventional LED light, a conventional LED light would be a 20-second for metal brackets and 30 seconds for a molar tube. With this technology of the cool beam, they've been able to reduce that by half. So it's 5 seconds for all bracket types and 10 seconds for the molar tube. Now, the newer, sleeker version of this is the Demi light, and what I like about this, you can see it's not as bulky. It's very easy to, has its own docking station to recharge, and just, you know, look at the size really of the two lights next to each other. Much heavier, bigger battery pack. These are fantastic lights, and the technology to bond in directly, if you're using your standard composite light, it's going to overheat because it's not designed to do that many cures all in the same clinical procedure. So I'll hand over now to Con, who's going to talk you through the indirect bonding procedure using two trays. Con has just put in the Nola retractor. We saw that yesterday for the lingual retainer, and he's going to go through the isolation technique and then the actual bracketing right up till the arch wire and the stops, which will be an 014 copper nitai wire.
So the first thing we do is we place the Nola dry field, and then we prepare the two surfaces. And the way we prepare it is simply pomacing the two. Sometimes I just use the Profi brush without the pomace if patients come in quite clean. So we'll get the pomace. So we're doing the lower indirect bond up, 6 to 6. The tray consists of 12 teeth. I'll get some more pomace. Get rid of here. Thank you. Most important thing is that the pomace is not Profi paste. It does not contain fluoride. The reason being, fluoride will inhibit our etch and make bonding more difficult. So then next step, we give it a quick little rinse to get rid of any excess saliva or debris that we've left around. And now we'll start by etching the teeth with 37% orthophosphoric acid. And I etch the entire arch because I've got the Nola dry field in. It means I can wash dry and then I'll keep the whole mouth dry, thereby reducing the amount of potential problems I can encounter if I need to rinse, wash, dry during the procedure. The tray will go on in one piece. Sometimes if the patient's difficult or the tray extends to the second molar, tooth number 7, I will section the tray into two parts. I personally, because I'm right-handed, like to section my tray from around about the 3.3, 3.4, so that includes the 3.4, 3.5, 3.6, 3.7, which I place and set first, and then I do the remainder of the arch from the 3.3 around to the 4.6 in one piece. Reason being, I'm right-handed, I can hold my left, and we can fill with the right. I find it more comfortable that way. Then I place my bond. Routinely, I just place it from the front, work my way back, and I pat it in. And you'll notice that I've omitted the 6s for the moment. I'll do that at the very end to make sure, just before I do my final check before getting my tray. And that's because it's the most commonly contaminated tooth. Then my nurse hands me my tray, which she's already applied the green goo on. And she's patted it into the base, like butted it up. And you can see there's very little adhesive required. And then we seat the tray without compromising the bond on any tooth. And that's, so once we've got it seated, open, ready, open, cool, just a little bit. We make sure, okay, you can close again as much as you can, see, just there, perfect. So now that I've got my tray down, seated, we make sure we keep it there when we like cure. Now I like to cure my sixes or my most terminal tooth first, and that helps in stabilizing the tray. So I push on the occlusal surface and the buccal surface of the teeth that I'm about to light cure. And some people advocate using tweezers or a ligature director, a tucker. I like the scaler, or this is especially the scaler with a band seater on the back of it. You can use tweezers, you can use whatever you like. I'm a creature of habit. I always over-cure because you can't essentially do that. You can under-cure if you don't have the light in the right position or right spot. However, if you just cure for that little bit longer, I find it helps me sleep better at night. Now, so our brackets are on. You can see tray is seated completely. There's no air pockets between the tooth and the tray. So hopefully that went quite well. Now, first thing we do is remove the trays. We remove the upper layer, thicker layer first, and you can see where the tray is sectioned. It is just above the bracket itself. So I like to use a scaler for that reason. Open a little bit, buddy, and you'll see just pop it up on one side. This is quite stable once it's seated. So we go from the buckle, and the lingual is a great way to lift it on the lower. And we do the opposing side as well. And you'll see the tray, the outer thicker tray is removed. Now this is quite good just as an aside bit of tip. If you don't have your models handy and you're about to put your initial arch wire, good idea to actually use this as a template for measuring your arch wire. That way you don't have to cut, or you don't end up with the wire poking into the patient's cheek before you cut in the mouth. That's a little tip there. Comes in handy. Now, the remaining teeth, you can see that the 0.6mm tray adapts quite well around the teeth. Hopefully the tray has been sectioned interproximally, like this one has, to allow you to lift each tooth, or lift the tray around each tooth, or each brace, thereby overcoming the undercut. We just peel it off one by one. Other people have advocated using Mahony's forceps to roll the tray over the brackets. So we just go around and remove any flash or excess resin, and you'll learn pretty quickly actually that you don't actually need a lot of adhesive to stick on an orthodontic bracket. I'll give that a quick little wash, and normally this is where we place our occlusal stop, and we'll do that now. Now in his case I'm going to use some either Fuji 7 or Reba GRC. However, if I wanted to, excluding the bite was very important, it was imperative that we needed to jump across bite, we would put composite resin. Now we would do the bond ups when majority of cases we want to put some bite turbos. A lot of times we just put composite or GRC on the lower sixes, just because it's convenient, but in the majority of cases we actually should be placing bite turbos on the palatal of the upper central incisors. But I'll engage the arch wire now for the purpose of this demonstration, and So I'll get an 01. We're going to start him off with a copper nickel titanium, the diamond wire. One of our favourite starting wires is the 013 or 014 copper nitrile. And in some cases I may even be adventurous and start with an 016, depending on the treatment required. In this case, we'll start him off with an 014, and then we'll use the arch template, the indirect bonding template, and ligature cutter, so end cutter, and then again open. So we've got my template there, and I use my arch wire cut. So just a rough cut, slightly long, but we don't want it too long so it pokes into the patient's cheek. So we've got our arch wire. Normally we'd have the Nola retractor removed, but for this demonstration it'll be easier if I leave it in so you guys can see. So bear with me because it'll be a little bit trickier for me. And usually we use a ligature director or a tucker, but I will use just my finger. And I like to use my vine guard to close my brackets, close my gates. You can use your finger, you can use whatever you like. That's closed. So I put the left side in this case I'm going to go 2 or 3 teeth as well, just so we don't get the arch wire moving around too much while I'm seating the other side. So then we have to use a tucker now, get a tucker. So while we're getting ready to tuck that and tie those in, I'll put the other side into the tube. So we hold the wire next to the tooth and then we simply push it into the slot and engage. That was me using a ligature director or tucker to open my gate that I just closed. So we look for the middle marker in the arch wire that indicates the midline. So I've got the midline over to the right, so I'm going to pull the arch wire to the left. And when there's as much crowding as this case, sometimes you might not be able to pull it just straight through, but I can in this case. This is our cool tool. This is being Gaming cool tool, gets kept in the fridge, and the way it works, you can see the little groove that's present just here. We put our arch wire along there, that way we can push our bracket mesial and distal, and then we can close our gates. So turn your head to the left, buddy. Good. So you can see here the 4-3 is lying outside the arc, and I engage it with the cool tool, being careful not to touch the cool tool for too long with my warm hands, because it's a very good conductor. So open a little bit wider, buddy. I engage the mesial and distal, and I push against the tooth so the wire is out of the way of the gate, and I close the gate, trapping the wire inside, thereby allowing the force or the tooth to be engaged and a force to be placed. Okay. Now a bit of advice: if you're struggling to get this, say you get this in, your cool tool is warm, I'll get some cold spray, which is, you can use endo frost, you can use any sort of, you can use dry ice if you really wanted, but we just get some cold spray and we spray onto the back of a cotton roll. So, yep. This again. So we get our cold spray. Just cryogenic spray. Just any cold spray will do. We cut a section of the tip and we just spray it onto the end of a microbrush, end of a cotton roll. So this end is warm where I hold, and this side is quite cold. What I do then, I then place the cold end against the arch wire, being careful not to stick it against the teeth or lips or the tongue. Otherwise we may reenact the scene from the movie Dumb and Dumber. Okay, so that wire, you can see that now. Look at it. It's chilled and it becomes like spaghetti, thereby making it a lot easier for me to place into the bracket, or the slot of the bracket. And I can use my quill tool, tucker, whatever I want to use. And open. In there. Should I not been able to get through into that wiring, I would have had to step back and arch the arch wire to a smaller diameter and then engage it. And we make sure, so we go around and check every gate. And we also inspect the brackets to see if we see any green components, or green elements. Reason being, the green goo is green in colour, and when it is not set or not fully polymerized, it turns green. So I'll just take off take that off. Once we've done that, what I like to do, I like to sort of inspect the occlusion before we place the braces on, and as we would know, which I have done already, but just to show you guys, bite together. And you can see he's hitting on some braces there, namely the 3-4, the 3-3, all the teeth that are rolling in the 4-5. Any teeth that's got a lot of buccal roll, or it's leaning in towards the lingual, means that the buccal surface is exposed on the outside, and the bracket is more likely to be in contact with the occlusion. In which case we are going to put some occlusal stops to exclude the bite and allow those teeth to upright on their own without any interferences. And for that we'll use some glass ionomer cement. So I'll put the null retractor back in for this exercise so you can see where I put my stops. The null retractor gives us a good field of view. And he's got a lot of saliva, our patient. Must be getting hungry. And then just to make it a little bit easier, we've used a little bit of monomer on a micro brush just to give us a nice smooth occlusal stop, otherwise the patient won't really appreciate it. Now this is Fuji 7, or the that's quite good. Good. So just gently close together. That's where you first touched. Just stop there. Good. And you can see there that he's quite clear on the teeth in question before. So that's reasonably soft, that material. So stay open. We'll let that set a little bit firmer before we dismiss him. Otherwise, as soon as you dismiss the patient, they will chomp down and they will soften their right up. So we get suction. Keep it dry. So without putting your teeth together, we'll take that off. And just check the wires before, and we'll crimp our stops. So I guess a vine cutter and end cutter. In the mirror too. Yep. So with our stops, I've placed the mesial and distal to the lower right canine. Reason being, the inter-bracket distance between the central lower incisors is too small for it to place a stop here. If I place a stop here, it will constrict the arch wire from moving, or stop this tooth from moving forward. So I've got my stop here. I'll place it not tight up against the 3, just to give it a little bit of space there to allow this tooth to move as well. One stop in this case would be enough between the 3 and the 2. with a little bit of play, allowing that to rotate around if needed. The second arch wire stop there, I'm not going to engage, as I don't need to. Or I'll do a very light crimp just there, which means that you can move it if you need. The arch wire shouldn't anyway. Okay, we check our ends before patient leaves every visit. Very important, you don't want to leave any poking wires.